Okay, so this is part 2 of the series answering the question, what if therapy isn't working for me? 10 ways to make the most out of therapy. So number 4 is to prepare for sessions. Think about how you're doing throughout the week and make notes so that when you go into therapy, you have something to talk about, you have questions, you have a place to start in your session. Number 5 is to do the work outside of session. Okay, so if the therapist and you have talked about you're going to practice talking to a new person because you have a lot of social anxiety, or you're going to practice setting limits on your phone, whatever it may be, really try to do that work, really try to do the thing that you discussed. Therapists know you're not perfect. They should be compassionate people, and you're gonna fail. You're not gonna be perfect at these things. That's why you're going counseling. But try, and then talk to your therapist about what's not working. Talk to them about like, hey, I tried to set a limit on my phone. I was really struggling. It was really hard. And see if you can work on some other ideas. And then number 6 is similar to that one, but read the suggested reading, read the supplemental material. So if your counselor is suggesting a podcast to listen to, a YouTube channel to follow, a book to read, if you can, really try to look into those things. The clients who change the most are the ones who are doing the work outside of session. They're really investing a lot in their lives and in their mental health, and they're not just relying on a 50-minute session to change them, because truthfully, that's not going to be enough. You have to do the work. We all have to do the work for ourselves outside of the session, and the therapist is there to come alongside and support you in that process, but not to do all the work for you, because it just isn't going to work. So that is part 2. Stay tuned for part 3.